Let me start with a question I ask every patient who walks into my office after the age of 50. Do you know your blood pressure numbers? Most men say yes. Then I ask, are you sure those numbers are accurate? That's where the silence usually starts. And here's the truth most people never hear. Your blood pressure machine might be fine, but the way you're using it could be quietly giving you the wrong reading. And those wrong numbers can lead to wrong decisions, unnecessary worry, or worse, missing a real problem entirely. As we get older, especially after 50, our bodies don't respond the same way they did in our 30s. Arteries stiffen, stress affects us more deeply, sleep changes, and even small lifestyle habits start to carry more weight. Blood pressure becomes one of the most important health signals we have, yet it's also one of the most commonly misunderstood and poorly measured. I see men every week who think their blood pressure is out of control, when in reality, they're just making simple measurement mistakes at home. One of the biggest challenges for men after 50 is consistency. Our routines change. We may retire, become less active, or sit for longer periods. Some men are caring for family members, others are dealing with work stress or financial pressure. All of this affects blood pressure. But here's the key point: blood pressure is not a fixed number. It moves throughout the day, and how and when you measure it matters more than most people realize. Let's talk about the first common mistake right away: measuring your blood pressure at the wrong time. Many men grab the cuff first thing after rushing around, drinking coffee, checking the phone, or dealing with morning stress. Others measure it late at night when they're exhausted. Both can give misleading results. Your blood pressure naturally rises in the morning and fluctuates with activity, mood, and even temperature. If you don't give your body a few quiet minutes to settle, you're not measuring your true baseline, you're measuring your reaction to life in that moment. Another mistake I see constantly is measuring blood pressure right after physical activity. That includes things most people don't even think about, like climbing stairs, carrying groceries, or even walking quickly to another room. Your heart responds immediately to movement, and it takes time to return to a resting state. Sitting down and wrapping the cuff around your arm too quickly almost guarantees a higher reading. That number doesn't reflect your resting blood pressure, and that's the number that actually matters for long-term health. Now let's talk about posture, because this one is quietly throwing off millions of readings every single day. Men often sit on the edge of a chair, feet dangling, back unsupported, arm held up in the air, or resting awkwardly on a desk. The body reads that as effort. When your feet aren't flat on the floor or your back isn't supported, your muscles stay engaged. Engaged muscles raise blood pressure. Even crossing your legs can slightly elevate the reading. It sounds minor, but over time, those small errors add up. Another issue that becomes more common with age is stiffness in the shoulders and arms. Men over 50 often hold tension without realizing it. If your arm isn't supported at heart level, your blood pressure reading can be artificially higher or lower depending on the position. I always tell patients, your arm should be relaxed, supported, and comfortable. If you're holding it up, you're working. And if you're working, the reading isn't accurate. Let's touch briefly on breathing, because this is one of the most overlooked factors. Many men hold their breath without realizing it, especially when they're anxious about the number they're about to see. Holding your breath, talking, or even thinking stressfully during the measurement can change the result. Slow, steady breathing helps your nervous system settle. That calm state gives you a reading that actually reflects your health, not your worry. Lifestyle habits play a huge role here too, especially after 50. Caffeine, salty foods, poor sleep, dehydration, and stress all affect blood pressure. Measuring right after coffee or a heavy meal is another common mistake. Your blood vessels respond quickly to what you consume. If you don't account for timing, you may think your blood pressure is climbing when it's actually your habit speaking, not your heart. And this is where many men get discouraged. They see a high number, feel frustrated, and assume something is wrong with them. But in many cases, nothing is wrong at all. The body is simply responding normally to timing, posture, and daily habits. Understanding this can take a lot of unnecessary fear out of the process. In the next part, I'm going to walk you through more mistakes that quietly sabotage accurate readings, including cuff size, arm choice, and why checking too often can actually make things worse. These are things I explain every day in the clinic, and once you understand them, Measuring your blood pressure becomes far less stressful and far more useful. Now let's move into another mistake that causes a lot of confusion, especially for men after 50, and that's using the wrong cuff size. This one is huge, and yet almost nobody talks about it. Many men assume that if the cuff wraps around the arm, it must be fine. But that's not how it works. If the cuff is too small for your arm, it will squeeze more than it should and give you a higher reading. If it's too large, it may give a reading that's lower than reality. Either way, the number you see isn't telling the real story. As men age, body composition changes. Arms may become thicker or looser, even if overall weight hasn't changed much. Using a standard cuff when you actually need a larger one is one of the most common reasons I see falsely elevated blood pressure readings at home. And the frustrating part is that men often blame themselves, their diet, or their health, when the real problem is just a poorly fitted cuff. A properly sized cuff should feel snug, not tight, and it should sit comfortably without digging into the arm. Another mistake closely connected to this is placing the cuff incorrectly. I see cuffs placed too low near the elbow, too high near the shoulder, or twisted slightly around the arm. Even small misplacements can affect accuracy. The cuff needs to sit directly on bare skin, not over clothing, and it should be positioned evenly so the pressure is distributed correctly. Measuring over a sleeve, even a thin one, can alter the reading more than people realize. Let's talk about which arm you're using, because this confuses a lot of men. Some people switch arms randomly. Others always use the arm that gives the lower number because it feels reassuring. But consistency matters. For most people, one arm naturally reads slightly higher than the other. That doesn't mean something is wrong. It just means your circulation isn't perfectly symmetrical, which is normal. What matters is picking one arm and using it consistently so you can track trends over time instead of chasing individual numbers. Another very common mistake is measuring blood pressure too often. This surprises a lot of men. They think checking more frequently means better control, but what often happens is the opposite. Repeated measurements can increase anxiety, and anxiety raises blood pressure. I've seen men sit down and take 3, 4, even 5 readings in a row, watching the numbers bounce around and getting more frustrated each time. The body senses that tension and responds accordingly. Blood pressure is meant to be measured calmly, not obsessively. When you turn it into a test you're trying to pass, your nervous system stays activated. That alone can raise the reading. 1 or 2 well-timed measurements taken correctly tell you far more than constant checking throughout the day. Now let's talk about timing in a different way. Many men measure blood pressure only when they feel off or stressed. That's understandable, but it doesn't give you a full picture. Measuring only during moments of discomfort or tension almost guarantees higher readings. What you want to know is how your blood pressure behaves during normal, quiet moments. That's the baseline that matters for long-term health. Sleep also plays a role here, especially after 50. Poor sleep can elevate blood pressure the next day, sometimes significantly. Men often underestimate how much sleep affects their cardiovascular system. Measuring blood pressure after a restless night can lead to concern. Even though the body is simply recovering, that doesn't mean you ignore the number, but it does mean you interpret it with context instead of panic. Another lifestyle factor that sneaks into blood pressure readings is dehydration. Many men don't drink enough water, especially as they age. Dehydration causes blood vessels to narrow, which can raise blood pressure temporarily. Measuring during a dehydrated state can give you a higher number that doesn't reflect your usual condition. Something as simple as hydration can change a reading enough to cause unnecessary worry. Stress deserves special attention here. After 50, stress doesn't always feel the same as it did earlier in life. It may not come with racing thoughts or obvious tension. Sometimes it shows up as irritability, fatigue, or mental overload. The body still responds physiologically, even if the mind doesn't label it as stress. Measuring blood pressure while carrying unrecognized stress can quietly elevate the result. Another subtle mistake is talking during the measurement. Men often chat, comment on the number, or even laugh while the cuff is inflating. Talking activates muscles and changes breathing patterns. Even small movements in the arm or upper body can influence the reading. Silence during measurement isn't about being serious, it's about letting the body stay still and relaxed. Let's also address the environment. Measuring blood pressure in a noisy, uncomfortable, or distracting place can alter the result. If the television is loud, the phone is buzzing, or you're rushing out the door, your body doesn't settle into a resting state. Blood pressure reflects how your nervous system feels in that moment. A calm environment helps your numbers reflect your actual health, not your surroundings. One thing I always emphasize is this: blood pressure is information, not a judgment. Too many men attach emotion to the number. They see a higher reading and feel like they've failed somehow. That emotional response alone can push the next reading higher. Understanding common mistakes takes the pressure off, mentally and physically. In the next part, we'll talk about how daily habits, routines, and long-term patterns affect blood pressure readings, and how to build a simple, reliable measurement routine that actually works for men after 50. This is where everything starts to come together. Now let's slow things down and talk about daily habits, because this is where many blood pressure mistakes are quietly built into everyday life. Men after 50 often focus only on the moment they measure their blood pressure, but what happens in the hours before that moment matters just as much. Blood pressure reflects patterns, not just single readings. One of the biggest long-term mistakes is not having a routine. Measuring at different times every day, under completely different conditions, makes it almost impossible to understand what your numbers really mean. Morning one day, afternoon the next, evening another day, each reading reflects a different physiological state. Over time, this creates confusion instead of clarity. The body likes consistency, and accurate blood pressure tracking depends on it. For most men, the best readings come when the body is calm and predictable. That usually means measuring around the same time each day after sitting quietly before major activities. When you do that consistently, the numbers start to tell a story instead of sending mixed signals. You begin to see whether your blood pressure is stable, improving, or slowly changing over time. Another common mistake is ignoring how food choices affect readings. After 50, the body processes sodium differently. Meals high in salt can raise blood pressure for hours, sometimes longer. Measuring shortly after a heavy or salty meal often leads men to believe their blood pressure is getting worse, when in reality it's a temporary response. This doesn't mean food doesn't matter, quite the opposite. It means timing matters when you measure. Alcohol is another factor that confuses a lot of men. Even small amounts can temporarily raise blood pressure, especially later in life. Measuring on days when alcohol is involved and comparing those numbers to other days without context can lead to unnecessary concern. Blood pressure responds to what you put into your body, and the response becomes stronger with age. Physical activity is healthy, but measuring too close to exercise is another common mistake. Many men take their blood pressure shortly after walking, stretching, or doing chores, thinking they're checking how fit they are. But blood pressure naturally rises with movement. What you want to know is how well your body recovers, not how high the number goes during activity. Giving your body enough time to return to a resting state is key. Now let's talk about sitting quietly, because this sounds simple but is rarely done properly. Men often sit down and immediately start the measurement. The body hasn't had time to shift into rest mode yet. Heart rate and blood vessel tone take several minutes to settle. Skipping that quiet period is like checking your speed the moment you hit the brakes. It doesn't reflect where you actually end up. Breathing again becomes important here. Slow, natural breathing helps signal safety to the nervous system. When breathing is shallow or rushed, the body stays alert. That alert state raises blood pressure slightly, even if you don't feel stressed. A calm breath pattern helps your reading reflect your true resting condition. Another mistake is measuring while multitasking. Checking messages, watching the news, or thinking through the day ahead keeps the brain active. The brain and heart are deeply connected. Mental activity influences blood vessel tone. If the mind is busy, the body doesn't fully rest. Blood pressure measured during mental stimulation is often higher than it would be in a quiet state. Men after 50 also face a unique challenge with expectations. Many expect their blood pressure to look exactly like it did years ago. When it doesn't, they assume something is wrong, but normal ranges can shift slightly with age. The goal isn't perfection, it's stability and awareness. Understanding your own normal matters more than chasing a specific number. Another long-term mistake is reacting too strongly to a single high reading. Blood pressure fluctuates naturally. One elevated number doesn't define your health. What matters is the trend over time. Men who panic after one high reading often create a cycle of stress and repeated checking, which keeps numbers elevated and increases frustration. Let's talk briefly about medications, because even when used correctly, timing matters. Some men measure blood pressure right after taking medication and expect immediate changes. Most medications don't work instantly. Measuring too soon can create the impression that nothing is helping, when in reality the body just needs time. Understanding this prevents unnecessary worry. Sleep quality again plays a quiet but powerful role. Poor sleep raises stress hormones, which affect blood pressure the next day. Men often overlook this connection. Measuring after nights of poor rest and comparing those readings to well-rested days without context can be misleading. Sleep isn't just rest, it's regulation for the entire cardiovascular system. One more subtle mistake is not writing numbers down. Relying on memory leads to selective recall. Men tend to remember the highest readings and forget the normal ones. Keeping a simple record helps create an accurate picture. Over time, patterns become visible, and those patterns are far more meaningful than individual numbers. As men get older, the goal shifts from reacting to numbers to understanding them. Blood pressure monitoring should reduce uncertainty, not increase it. When done correctly, it becomes a tool for confidence instead of concern. In the next and final part, we'll talk about how to put all of this together, how to measure blood pressure in a way that supports long-term health, reduces stress, and helps you make better decisions moving forward. Now let's bring everything together, because by this point you can probably see that measuring blood pressure isn't just about pressing a button on a machine. It's about creating the right conditions so the number you see actually means something. For men after 50, this becomes even more important because the body is more sensitive to routine, stress, and lifestyle than it used to be. One of the biggest shifts I encourage men to make is changing their mindset. Blood pressure is not something to fear, it's feedback. When you approach it calmly and consistently, it becomes one of the most useful tools you have for protecting your long-term health. When you approach it with tension or urgency, it turns into a source of stress that works against you. A simple, repeatable routine makes all the difference. Same general time of day, same arm, same position, same calm environment. When you do this, you're no longer guessing, you're observing. And observation leads to better decisions. Over time, you'll start to recognize what affects your numbers and what doesn't. That awareness alone is incredibly empowering. Another important point for men after 50 is patience. The body doesn't change overnight. Blood pressure reflects weeks and months of habits, not just one good or bad day. When men expect immediate improvement, they often get discouraged and give up too soon. Small, steady improvements in routine, movement, sleep, and stress management have a much bigger impact than sudden, extreme changes. Lifestyle choices matter, but they don't need to be perfect. Regular movement, balanced meals, hydration, and consistent sleep create a foundation that supports healthier blood pressure over time. Measuring correctly allows you to see the impact of these habits without distortion. It helps you connect cause and effect in a clear, realistic way. Stress management becomes especially important as we age. Stress doesn't always announce itself loudly. Sometimes it shows up quietly in the body, raising blood pressure without obvious emotional signs. Creating a calm measurement routine helps you separate temporary stress responses from real long-term trends. That distinction prevents unnecessary worry and overreaction. Another thing I remind men is not to compare their numbers to others. Every body is different. Genetics, history, and lifestyle all play a role. Comparing your readings to someone else's often leads to frustration or false reassurance. The only meaningful comparison is with your own past readings, taken under similar conditions. Communication with healthcare providers also improves when measurements are accurate. Bringing in consistent, well-measured readings allows for better conversations and better guidance. It reduces guesswork and helps decisions be based on real patterns instead of isolated moments. Most importantly, measuring blood pressure should fit into your life, not take over your life. When done properly, it takes only a few minutes and provides valuable insight. When done incorrectly or obsessively, it creates stress and confusion. The goal is balance. As men move through their 50s, 60s, and beyond, awareness becomes a form of strength. Knowing how to measure blood pressure correctly is part of taking ownership of your health. It's not about chasing numbers. It's about understanding your body and responding thoughtfully. If you take nothing else from this, remember this: calm, consistent measurements tell the truth. Rushed, stressed measurements tell a story you don't need to hear. Choose the truth. Give your body the conditions it needs to speak clearly. That's the foundation for healthier blood pressure and a more confident approach to aging well. Before we finish, I want to leave you with something important, especially for men after 50. Blood pressure is not just a medical number. It's a reflection of how your body is coping with life. When you measure it correctly, it gives you insight. When you measure it incorrectly, it creates noise. And too much noise leads to confusion, stress, and sometimes poor decisions. One of the quiet mistakes men make is ignoring how emotions influence the body. You may not feel anxious, but your body might still be carrying tension from responsibilities, worries, or long-standing habits. Blood pressure often picks up on that before you consciously do. That's why a calm measurement routine matters so much. It gives your body permission to settle before you ask it for information. Another thing I often tell men is this: don't let one number define your day. A higher reading doesn't mean you've failed. A lower reading doesn't mean everything is perfect. Blood pressure is a moving signal, not a grade. When you stop attaching emotion to each measurement, you gain clarity instead of stress. Consistency over time is what protects your health. A handful of accurate readings taken correctly tell you far more than dozens taken randomly. When men simplify their approach, they often feel more in control and less overwhelmed. That sense of control itself supports healthier blood pressure. It's also important to respect your body's rhythms. As you age, recovery takes longer, stress lingers a bit more, sleep has a bigger impact. Measuring blood pressure with awareness of these changes allows you to respond intelligently instead of reactively. Aging isn't a weakness, it's a shift in how the body communicates. Men after 50 often carry a lot silently. That weight doesn't always show on the outside, but the body feels it. Blood pressure is one of the ways it speaks up. Listening without panic and responding with steady habits is one of the smartest things you can do for long-term health. I also encourage men to focus on what they can control. You can control when you measure. You can control how you sit, breathe, and relax. You can control how you interpret the number. Those small choices create a big difference over time. If measuring blood pressure has ever made you feel tense, frustrated, or discouraged, that's a sign something in the process needs adjustment, not that something is wrong with you. When the process becomes calm and predictable, the experience changes completely. The goal is confidence, confidence in your routine, confidence in your understanding, confidence that the numbers you're seeing actually reflect your body, not your stress, posture, or timing mistakes. That confidence supports better decisions and better conversations about your health. As you move forward, think of blood pressure monitoring as a quiet check-in with your body, not a test. Give yourself a few minutes of stillness. Let the body speak clearly. Over time, those moments add up to better awareness and better health. That's how you use blood pressure as a tool instead of a source of worry. And that approach, more than any single number, supports healthy aging and long-term well-being. If you found this helpful, take what you've learned and apply it calmly. Your body will thank you for listening the right way.